You're listening to On Air with EUFOREA.
Hi, everyone. This is On Air with EUFOREA. I'm Elizabeth Van Staeyen, and I'm the Scientific Communications and Advocacy Manager here at EUFOREA. And I'm here today with Mr. Andrew Knill. Andrew, welcome.
Thanks very much.
So Andrew is an old friend of EUFOREA. So Andrew actually started Sinus UK, which is perfect on the theme of this year's Global CRSwNP Awareness Day, which the theme is the empowered patient. So Andrew, what can you tell us a little bit about how you became empowered and what Sinus UK means to you, and a little bit about your journey?
Yeah, no, thanks very much for that. And you're right, I am a friend of EUFOREA is a good way of describing it, because I've been a CRS with NP patient for over 20 years now, and I've had a long and difficult journey, but it was only in about 2015-16 when I found out about EUFOREA, and that started my advocacy journey. And I was able to come along and speak at some EUFOREA events and be part of the patient advisory board there, and really that led me to a point of setting up Sinus UK. So no, it's great to be invited to come and speak to you.
Thank you so much. So what's a little bit about how long did it take you to get a diagnosis? Was this something that you had lived with for years and didn't quite know, or was this something where you really felt like, hey, I can go to my doctor and say, we need to look at this? What was kind of your patient journey?
Yeah, so it's a good question. I think the difficult thing is when you wake up one morning and your nose is a bit snotty, you don't think, oh, I think I might have chronic rhinosinusitis with nasal polyps. The world doesn't work that way. You wake up one morning and you might have some symptoms and they're mild, and they get a little bit worse and a little bit worse. And eventually you'll think, well, maybe I'll do something about this. And you'll visit your pharmacist, or you may even go to the GP. But that was very much indicative of what happened to me. I started off asthmatic as a young child. This is in the 1980s. It was easy to diagnose asthma. There was a lot of awareness. And so that was diagnosed and treated. That came back in my late teens, early 20s.
As it does.
As it sometimes does. They're very much linked, I believe, Elizabeth. But and it came back then, but it also came back with sinus symptoms. And that then really took me about 4 or 5 years to get a diagnosis. And I'm in my early 20s. I wanted to go out and socialize and do all the things that people in their early 20s do. And it was severely impaired by the fact that whenever I did anything, my nose would end up really bad. I wasn't sleeping very well. I think it affects my productivity, a lot of face pain and all manner of things. I lost my sense of smell. But I didn't know what was wrong with me. And I kept on going initially to the pharmacist to take some over-the-counter treatments, and they weren't doing anything. And then to my GP, and I think I had one GP say to me once, "Oh yeah, I get snotty nose from time to time. We all do." Which is just not helpful, is it? So eventually, I was very fortunate that an old boss of mine, really lovely guy, offered to pay for me to have surgery. And I thought, well, that's going to be the kind of answer, which exactly, I was like, wow, that's really, really kind of you. And I had my surgery done by a general surgeon. And then 3 months later, I'm back in to see that person. My nose is just where it was, to which he concluded, I'm just a bit sensitive. Which is about the most unhelpful thing you can do. So I'm still now in my mid-20s. I'm still none the wiser as to what's wrong with me. And eventually I was very fortunate. I found myself at the door of the Royal National Throat, Nose and Ear Hospital. I did get seen by an ENT consultant at one point. That didn't help especially. But when I got to the Royal National Throat, Nose and Ear Hospital, that's when I got a proper diagnosis. So there's multiple names for what I have. I have chronic rhinosinusitis with nasal polyps and asthma, which is very wordy. It's about 300 in Scrabble, I think, if you ever managed that. I've got something called AERD, which is aspirin exaggerated respiratory disease. So that was the condition that I was diagnosed with them, also sometimes called Samter's triad. And the triad, the three things of the triangle being nasal polyps, asthma, and what's called a sensitivity to aspirin.
So you were the poster child.
I very much was, yes. That's of all the things that I could be in my life, I was the poster child for AERD. And so that started me on a journey, and it probably still took another 10 years before I had what you would call disease control. So till I got to a point where you could say, I got my smell back, which was just a wonderful experience. That was like all my Christmases come at once. But the face pain had gone, etc. So, but I was very lucky. It was getting to the right consultant. That was the person that made a big difference.
And when you did get to that right consultant, what did you feel like the treatment options were adequately explained to you? I know you mentioned a little bit in the beginning, and I think that so many patients experience this where it's, oh, we'll just do surgery.
Yeah.
Right. And we want patients to know that that's not the only option. So, and I think that so often patients aren't presented with the different options. Were any resources made available to you about what you had, or is this something that you struggled to find?
Yeah. So it's another good question, because this was like 15 years ago. And at the time, I think knowledge about CRS with NP is so much better now than it was. I think the treatments are available are so much better. I was very fortunate that the consultant that I saw was absolutely the forefront of the thinking in this area. And so initially, I really struggled to find anything. In fact, I didn't hear the name CRS with NP until probably about 10 years later. So it was Samter's triad. That's what I was diagnosed with. But never an explanation around the kind of the nasal polyp part of it, which is the nasal polyps, the bit that caused me the most problems, or have caused the most problems. So no, information was pretty non-existent, a few kind of photocopied leaflets. The other thing that's really important is at the time I had to try a more restricted diet because of the aspirin sensitivity. Thinking around that has changed, but for years I cut everything out of my diet that I loved. Spices, red wine, honey. There were all these things because salicylates are naturally occurring in lots of things. And so I had a really boring diet for years.
And did you have your sense of smell and taste?
No, not at that time. I didn't. So in one respect, you could live without those sorts of things, but there are gradations of smell and taste. I always sort of explain it to people if it's like saying, can you taste that's sweet? Well, absolutely. And that's sharp and that's sour. But if you said to me, he's rose-scented chocolates, can you taste the rose in them? I'm like, well, no, not at all. I can taste chocolatey niceness. So I had, to a certain extent, a sense of taste, but I had no subtlety of taste and no smell at all. I mean, I would sort of explain to people like you have 5 senses in which to experience the richness that the world has to offer. So once you take away your sense of smell, so you're down to 4, your taste pretty much goes with that. So now you're down to 3. And for me, and I think for lots of people, because it's all centered around your ears as well, it affects your hearing slightly. So let's call that 2.5. So you've got 2.5 senses in which to experience the richness that the world has to offer. And you lose all those things, it is really, really difficult to deal with.
Right. And I think we've heard patients a lot of times, I think it may have even come from you, who said it's like experiencing the world in black and white, like watching TV in black and white.
I would love to stake claim to that statement, but I heard it at a EUFOREA patient group. And then You heard it here, folks. Yeah, exactly. I cannot reference cite that as being, but I have on many an occasion cited the woman who made that. And she was absolutely right. It is. It's like seeing the world in black and white. And so that's what it means to be a patient. So there wasn't enough information there at the time. And there certainly wasn't the range of treatments. And I know, having had 5 operations myself, really when you get to my end of the disease spectrum, your options are surgery. Well, that's been around for however many thousand years since trepanning was around and people drilled holes in your head to get rid of the demons. So that's not new. Or steroids, and strong steroids. And those have been around for a long time, and differing healthcare professionals have different views on the long-term impact of them. So it's a real shame in the 21st century that up until very recently, they've been the only forms of treatment that have been available. I'm very lucky. My 5th operation worked really well. And I think they'd all been starting to work on that. And the treatment regime I'm on, that's worked really well. And I can smell again. And as I mentioned before, those symptoms have really died down. They've not gone away. There's always that fear that they're slowly kind of like creep back. So kind of what you were talking about, it's not only the physical symptoms that are the burden, but it also addresses this mental health burden as well. Because I think a lot of what we've heard from many patients is that, even when you do start feeling better, there's always that fear of it coming back. Yeah, no, definitely. And I remember, like with my sense of smell, that's been really hard because that's come back a few times and then gone again. And that's harder. You kind of get used to not having it. But when it comes back and you realize how wonderful things can be, and then it goes again is really tough. But I think the mental health point is a really important one. You're 30% more likely to have anxiety and depression if you've got CRS. So as a condition, it can have not just a physical impact on you, but a mental impact. And I remember when I first met EUFOREA was at a patient group. So that's the first time I'd ever sat down with other patients. And this guy there, he spoke so openly and honestly about how much it affected his mental health. And I thought, I can really relate to everything you're saying. You sometimes you have a chronic illness, you sort of exist in your own little bubble. And I was thinking particularly when you have something wrong with your sinuses and this pressure in your face, it almost forces you back into your head, if that makes sense. You end up taking solace inside your own mind. And it can be a really lonely place. And, so absolutely getting the right treatment not only can help kind of the physical symptoms, but if it can help as well relieve some of the mental symptoms that come with it, I think that's really important.
And in being able to enjoy life in the way that you would without it. So,
absolutely.
Yes.
Absolutely.
So while we're talking about this disease burden, so Sinus UK has actually been doing some work on highlighting the disease burden of chronic rhinosinusitis with nasal polyps. So what can you tell us about that?
Yeah, so I suppose just to kind of explain, like I got to a point in my sort of patient journey and then became a patient advocate, and I realized that there wasn't an organization that specifically spoke on behalf of patients with sinus diseases. So generally looking at sinus disease as a whole. And that's where Sinus UK came from. And one of the first things we had to do was think, okay, what do we want to be about? What are we going to do? And so we thought, okay, well, there's two areas that need focus in our opinion. And that was better information. So getting more information out there for patients by patients, so that wherever you were in your journey as a patient, you could get the help that you needed. So whether that is early on to help you understand that there could be something there that could be treated, or you've had a diagnosis and you want to understand more about what you have. So better information was one thing, and also better recognition. So generally within society, it just is a condition that I don't think we give enough recognition to. And so we started out thinking those things: better recognition and better information. So to begin with, we need to be able to explain the prevalence of the condition, so how common it is, and also the impact, like how much of an impact it has. And so we went to EPOS. Now, EPOS is the European position paper on rhinosinusitis.
Oh yes,
and nasal polyps.
We know and love EPOS.
And I was part of the group that contributed to it in 2020. And so we went back to that, and then we looked at what all the data was that was out there, and then we spoke to some of the EPOS authors, because there's lots of conflicting data particularly around prevalence. And so we created some kind of key messages around that, but also around the impact, is saying, how can we explain the impact in a way that will make people understand and take note, because that was really important. And it breaks down that about 1 in 5 people will have some form of sinus disease. So we'll have acute rhinosinusitis, which is a lot. I mean, it really is a lot. And then 1 in 10 will have a more chronic version of sinus disease, so we'll have chronic rhinosinusitis. So already as a prevalence, it's amazing. There's such a disconnect, really, between how prevalent it is and how much recognition within society we have on the impact. And just on the impact, so then what came from looking at this data was the impact on a patient's quality of life of chronic rhinosinusitis is equivalent to heart failure or angina or COPD. So these are conditions that we all understand. And when you think about heart failure, fear, absolutely. And the things that I don't have to explain to you how serious heart failure is. I mean, the two words explain it, heart and failure, are very clear in what that condition means. And it's a difficult condition for people to live with. So being able to explain that CRS is in a similar category and the impact it has on your quality of life, we've really found people take note of that kind of description.
They do. So you've heard it here. So we're so happy to have you as part of our network. We're so thrilled to see the work that you're doing, Andrew. And you can learn more about Andrew and the work that Sinus UK is doing at sinusuk.org. Thank you for joining us.
Thanks so much.
This was brought to you by EUFOREA, inspiring the future of respiratory care. This podcast was supported by an unrestricted educational grant from Sanofi Regeneron.